All right. One of the things that scientists work with when they are doing experiments with people, when they're running clinical trials, is they need funds. They need money to actually do clinical trials. Bringing a new medicine to market is incredibly expensive, very time consuming, very hard. And a lot of scientists, especially in dealing with humans and medicines, need to ask people for money. They kind of go out and beg for funding, okay? Hey, I'm making this great new medicine. Will you give me some money to do some clinical trials and see if it works? All right? And one of the things that they have to do is they write up what's called a grant proposal. These are what I'm doing. This is what I want to do. This is how I want to do it. Okay? Give me money, please. And then they send it out to people who have lots of money to give to them. Well, the people who have that money read their proposals. Oh, well, this is what they're trying to cure. This is how they think they can do it. This is how they're going to test it. This is where they're going to do their clinical trials and how they're going to do it. And yeah, I like this. I'm going to give them some money to help them out. Or they can also look at it and go, yeah, this scientist doesn't have a clue what they're doing. This is wrong, this is wrong, this is wrong. I'm not giving them any money. And so you have to evaluate the clinical trials, okay? And that's what today's activity is about. You are looking to see if they have the parts of a good experiment, a good clinical trial that they need, okay? You should have everything that's in this column, and you should have answers for it over here in your grant proposal if you want people to give you money. So you need to be able to tell them what problem you're trying to solve. You need to be able to prove to them that you've done some background research and you've been, careful about finding answers and all before you get started, so that you're not doing something stupid. You're doing something that's adding to what's already known, so that you're getting closer to finding cures or treatments or whatever. So you got to show them that you did some background research. You got to prove to them that you have a way to let people know what might happen, good and bad, okay, so that they can make the decision of whether or not they're going to be in your clinical trial. You have to know what your hypothesis is. What do you think is the answer to your question? Do you actually know that? Okay? Have you written out your procedures? Are you able to say exactly how you're going to do it, step by step, so that another scientist can also do the same experiment? Because when people are giving you lots and lots of money to do an experiment, it can't be bad science. It has to be good enough that someone else can verify or check your results. So have you told them how you're going to do it and do it well? Okay? Do you tell them exactly what you're testing? Exactly what you're testing. Have you controlled everything else? If you just say, hey, I'm going to go out and give a whole bunch of people some medicine, you haven't controlled your variables. What people? Children, adults, teenagers? Is it going to be boys? Is it going to be girls? Are they already sick? Are they healthy right now? What is going to be the same? That's your controlled variables. Are you going to have a control group? What do you plan to do to create a control group? Will there be a placebo? Okay? Sample size. Remember, bigger is better. So are you planning on giving this medicine to enough people? All right? Are you going to have a sample size that's worth it? Number of trials. You always want to be able to repeat your experiment. So do you plan on repeating it? What qualitative data are you going to collect? Remember, qualitative data is just descriptive words, descriptions, but it can be very, very important. If you're getting a shot, does it hurt? Does it burn? Does it sting? Does it cause itching around the injection site? all right? If it's a oral medicine, does it taste good? Does it taste bad? Is the pill too big to swallow? Is it a tiny little pill and it's easy to swallow? Okay. Do you have any side effects? Qualitative data is side effects a lot of times. How does it make you feel after? All right. And of course, quantitative data has to be collected. How many people get better? Okay. How much medicine do you need to take? How long do you need to take the medicine before you'll get results? That quantitative data that you're working with. You have to have set out and told people how you're going to take care of all of these different parts for it to actually be a good clinical trial. So it's really, really important to identify these. So you're going to be reading some stories about clinical trials, and you're going to try to identify each of these. And if they have it, you tell me what it is right here. All right? So you tell me what it is in this big blank space. If they don't have it, you say none. All right? And then we'll decide whether it's a good trial or a bad trial. And we're going to talk about how we could make it better and fix it. All right?